or maybe you did and you moved it and I wasn't paying attention. This slide's fine, actually. We always have a large group with us on our Family Echo series. We're really excited to have everyone here. So if we call out your region where you're from, give us a wave. We'd love to meet you and see people and see where you're from. We really like you to talk during these sessions. So, and chat things in, but, we always just want to remind you to, be conscious of your protected health information. We call it PHI. It just means, try not to share your child's name or your location or anything that really identifies them, because again, it's their health information. We like to keep that protected as much as possible. And we're going to do some polls and some surveys, so please fill those out. When you fill that out, it helps us measure, are we giving you information that's really helping and helping you to learn and move on to the next great and best thing, and where we can improve. And we love to have your voice infused into our series and how we design it. So please feel free to fill those out when they come your way. Next slide. If you need Spanish, you should already be with the interpreter. If you're having any issues, just reach out to anybody that has support in front of their name or hub support, and we can help you with that. Next slide. And resources. Again, you will have access to the resources and slides from today's session, so stay tuned for that. It will come to you in a separate email, and you'll see the live recording link and everything. It's a really nice compilation of everything we have to offer, so keep an eye out for that. Next slide. And again, if you're new to Zoom, remember, if there's a red line across your mute or your video, your microphone or your video, that means we cannot hear you, cannot see you. So please keep yourself muted so we can manage the background noise. But please open your video. We like to see everybody, but just remember, everything that is showing, we see too. So just keep that in mind. And feel free to use the chat option to ask questions, or if you need assistance, we're here to help. So use that anytime. Next slide. And again, turn on your cameras. You want to change your name in your square. If you see, like, my name actually says, Hub Amy Hess, and I'm the parent partner. So please feel free to do that. And then if you want to even include where you're from, because we have a lot of international people here, we'd love to know where you're from as well. Next slide. So again, a quick agenda overview. We're going to do welcomes. I want you to meet the incredible Hub team that's here and dedicating their time to really reviewing the topics that you want to hear and learn more about. We also want to, see where you're from and make sure that you're really with a large cohort of learners from across the US and actually the world at this point. But today we're going to start out with a case presentation. We're going to talk about a live case and really start to apply some of the principles we're learning. And then we'll go into the didactic, or the presentation as we call, with Dr. Eric Butter. And we'll have time for questions and discussion. And again, we're part of Project Echo. We record some of the data that you share with us. We record the sessions today. We just always want you to be mindful of that. Next slide. So I'm going to introduce you to our Hub team members today, and I'm going to start with Dr. Eric Butter, and he is going to kick us off for introductions. So Eric, take it away.
Hello, everyone. Welcome back. It looks like we have a lot of people back from last week, so I'm glad I didn't bore you or send you away. I'm Eric Butter at Nationwide Children's Hospital. I'm Chief of Psychology here, and I'm one of the site PIs in the Autism Care Network. We're really proud to be here doing this for you, and really thankful that you've joined us. I'm going to hand it off to Amanda Bennett.
Hi, everyone. Amanda Bennett. I'm a developmental behavioral pediatrician at Children's Hospital of Philadelphia, also site PI for the care network at that location, and really happy to be part of this hub. I'm going to hand off to Lisa Nowinski.
Hello, everyone. Lisa Nowinski. I'm a clinical neuropsychologist at the Mass General Hospital Lurie Center, just outside of Boston, Massachusetts, and so glad to be with you all today. Sapna, who is listed next, is not able to join us, so I'll pass it to Andrew.
Hi, everyone. Andrew Nelson with Autism Speaks and the Autism Response team there. We're so excited you joined us, and we'll tell you a little bit more about our services in a bit. And back to Amy, the host.
Hi, everyone. Again, my name is Amy Hess. I'm here at Nationwide Children's Hospital. I'm the parent partner for this team. I am the parent of a son with autism. So I share a lot of my life experience and learn a lot from this team. So it's really excited to have them here. Josh Edwards, who is our newest partner on the Hub team member, who's a self-advocate and also has a social work degree, is running a little bit behind. So he's not going to be here, but you will meet him definitely in the next session if you join us. So Sabrina, I'm going to hand it over to you.
Hi, everyone. I'm Sabrina Long. I'm a clinical social worker at Nationwide Children's Hospital in Columbus, Ohio. Cody Hostetler is one of our psychologists. He is not here yet. He may be here later. So I'm going to pass it off to Ellen Geib.
Hi everyone, near and far. My name is Ellen Geib. I am first and foremost a sister and a sibling. I have 2 siblings on the autism spectrum. I'm also a clinical psychologist at Nationwide Children's Hospital. And passing it off to Dr. Newmeyer.
Hi, I'm Dr. Amy Newmeyer. I'm a developmental pediatrician here at Nationwide Children's Hospital and co-PI with our site for the Autism Care Network. Dr. Bartram is out today, so won't be joining us. So I'll pass it along.
Great, thank you, Amy. Angie and Jackie are not with us today. They're actually on another meeting, so they'll be back with us next time. So Laura, if you want to go to the next slide, that would be great. All right, and Andrew, I'm going to hand it over to you to introduce yourself and all that you have to offer this cohort, as well as your counterparts.
Sure thing. We're really excited. Again, Andrew Nelson. I direct our autism response team at Autism Speaks, and I'm joined today by my colleague Sharon Danner. And Sharon is located in the Florida area, but both of us are here today for questions really from anywhere that you have about resources in your local area or your state, programs, things like that you might have questions about. So we're here to help.
Great. And Nancy, do you want to go ahead and introduce yourself, and then we'll hand it off to the rest of this tech support team?
You bet. Hi, I'm Nancy. I'm part of the Hub support team here. Please reach out to anyone that's got support in front of their name if you've got any challenges at all. We're here to help you out, and I'll pass it off to Melissa.
Hi everyone, I'm happy to help. Let me know if you need anything. I'll pass it off to Teresa. Oh, I'm Melissa. I'll pass it off to Teresa.
Hey guys, Teresa here. Thank you so much for joining us. I'll turn it over to Laura.
Hi everyone, I'm Laura. Thank you so much for joining us today. I'm sharing slides, so you might want to pass questions off to other support team members, but I'm also here to help if I do see it, and I'll pass it on. Oh, I think Nicole isn't here, so we'll just move on.
Great, thank you, Laura. You can go ahead and go to the next slide. This team, though, is really here to help. So if you have any questions during the session, just let us know and they can answer it. Again, we have last, I think, time we had 24 states represented. This time we have participants for 26 states. So welcome, I think it's Kentucky and the District of Columbia to the group. All right, next slide. And then we also, again, have participants coming from all over the world. So it's great to have you here. And again, you know, we may not be able to answer questions directly to your area, but we're willing to learn and willing to try to figure it out for you. So if you have a question, just let us know. Next slide. And then again, you know, we're part of Project ECHO, which is a huge initiative out of the ECHO Institute in New Mexico. And, you know, their premise is really about moving knowledge, not patients, through, you know, case discussions and presentations like we're going to do today. So as always, we're always going to start out with introductions and welcomes because we really want you to know who's on your team today. Today, we're going to do a case presentation. Sabrina's going to facilitate that and walk us through a case. We're going to do some clarifying questions and recommendations. If you have a question regarding the case or, you know, want to know more, ask that question. We'll try to, you know, either unmute you or answer it through chat. And if you have a recommendation, please add that because, you know, as a parent, I know one of the things I've learned is that parents always have great ideas and suggestions. So please share your knowledge. It just helps to bolster and build what we know. And then we'll go into today's presentation with Eric. And then at the end, we're hoping that we can give you lots of resources so you can take back what you've learned and apply it not just to your family, but back to your, you know, your community and back to share with your care team. So hopefully you'll get a lot out of today's discussion. Next slide. All right.
All right, everybody. We'll start off our session today with an opening poll. So please take a look at the questions that we have listed here. There are 5 total questions. Some of this may be very new information for you. So we encourage you to please take a guess, your best guess with these questions. You're going to see these questions again later after Dr. Buder's presentation. So you can keep some of the topics in mind because you'll have a chance to answer them again. We don't expect that folks will know all these answers. And here in just a minute, we should see some responses coming in. So please, if you can, head to your keyboard or grab your mouse and give a shot at answering some of these questions. For those of you that were with us during the last session, you know some of our questions are tricky, so we're going to watch for some of those points where questions may be tripping us up and see if we can offer some clarity throughout the presentation today. There we go. We've got one answer, a few answers trickling in. Keep those answers coming. We've got about 140 of us on the call today, and we would love to have all your input. So grab your mouse, take your best guess. Don't be afraid to take a guess. And we'll give everyone just a few more minutes to read and answer through these questions. As Amy shared earlier, some of the information we'll collect through this poll and through Echo helps us learn what topics we can cover, what content we can help teach. So we really appreciate your time in answering these questions. It looks like we've got some good responses coming through. Almost half of us have participated so far. So if you haven't had a chance to answer those questions, if you're having trouble scrolling down on the questions, you can use your mouse to grab that gray bar just at the side of the poll screen, and you can drag that down if you don't have a rolling bar on your mouse.
Looks like we have more numbers coming in. This is great.
Yeah, this is fantastic. Thanks, everyone. So again, 5 questions in total. If you didn't get to see all 5 of those questions, see if you can scroll down while holding your mouse over the poll. If you're having trouble, you can grab that gray long skinny bar on the right-hand side of your poll and just pull that bar down. It'll take you to the next questions. Trish, we may have to help you back channel. We'll see what we can do for that next one if you're having some trouble scrolling down. We'll see if our support folks can help us brainstorm there. Yeah, thank you for pointing out our questions are detailed today. So thanks for taking your time to read those.
I'm so impressed with the answers so far. People are really giving this a lot. Thank you, everybody. It's good to be primed for the talk later. Appreciate it.
Absolutely. Looks like question 4 is going to be our sticky one today. So we'll have to come back to that for sure as we're thinking about effective use of prompting.
Oh yeah, we're pretty evenly divided there.
This is great. So we'll take just a minute more. I think we're going to close up the poll here, and I will pass things off to Sabrina, who's going to get us started with our case discussion.
Thank you, Lisa. All right, so for those of you who were here last week, we're going to be talking about our case that we didn't quite get to. So we're really excited to do it this week and talk about topics from last week and topics you'll be learning. So this is Muhammad. He's a 4-year-old boy with autism and language delays. Family is originally from Somalia. He lives with his parents, grandparents, and older siblings. So in the home, the children and the parents speak both English and Somali. Grandparents only speak Somali. Muhammad has limited speech, but does understand both languages. Can go to the next slide. So the presenting concern, there are behavioral struggles at home, particularly with mother and grandmother. Muhammad has trouble waking up in the morning and refuses to get ready for school. When he wakes up, he would rather watch videos on his tablet. Mother is often not able to get him ready on time, so he is late or does not get to school. He does respond better to father or grandfather, but they are not always available to help. Siblings also are in school before him and not available to help. So the question is, how can we help the family get Muhammad to school on time? You can go to the next slide. So what questions do people have about this case? Is there anything else that you want to know? You can put it in the chat or you can unmute yourself.
Has mom or grandma tried to get him ready for school before giving him the tablet?
That is a great question. So they do not try to do that. He gets very frustrated as soon as someone tries to take the tablet away from him.
I'd want to know if there's also any problems at school, if there's any reason that or if it's a specific school avoidance issue, or if it's just, a tablet in general.
That is a great question, Marie. So this is, once we're able to get him to school, he does fine. It's really just about getting ready in the morning and getting there. I think there's questions in the chat, so many questions. So eating is a picky eater, but in general eats well enough, just particular about the foods. And then Lisa asked about sleep schedule. So sleep is not great. He has a hard time falling asleep. And so it often takes a couple hours to get him to sleep at night, and then he's a restless sleeper. Oh my goodness, you guys have so many great questions. Is it a sensory issue?
The use of visual.
I'm sorry, Heidi? Did you ask
Have
about?
they tried using visuals?
They have not tried using visuals, but that is a great question.
Visual schedule.
They have not tried that, but that
Okay.
is a great suggestion. All right, let me try to go through these chat questions.
Sabrina, this is Yetta. My question, and I threw this in the chat so you have to feel through, was
Thank you.
do they have a system in place like with the school? Have they consulted with the school in terms of taking what they're doing at school to generalize it to home to support him with getting ready in the morning?
That is a really great question, Yetta. They have not yet reached out to the school. This is kind of the first time they've approached this subject before, with me at least. I mean, me in a, and then other questions.
Sabrina, I wonder if I can toss you some questions consolidated from the chat. So we've got a few questions about visual schedules and for sun boards, as well as whether or not he has a regular schedule in the morning, right? Sort of the same thing every day.
So no visuals yet, but I love the idea of visuals and first then schedules. So that's something that we can suggest. No, it's a chaotic household in the morning with the siblings all getting ready for school. And so they do try, he doesn't always eat in the morning. It just depends on what they're offering. And then, I think definitely the tablet makes it a lot harder to follow the rest of the schedule.
Related to that, does he have free access to the tablet all the time? We had a question from someone in the chat about his access to that.
Yes.
Okay. And then Amy had a nice question about what dad and grandpa might be doing differently if he's having more trouble with mom and grandma. What are other?
No. That is a great question. I really think that it sounds like it is just their tone of voice is different, and so they're a little bit stricter as far as like this has to be done, and he tends to listen better to them. I don't know if it has something to do with being male or more of an authority figure in his mind, but that seems to be the difference.
The other two questions I have are around eating and sleeping. I see somebody asked about whether or not he's had breakfast and also what the family's done to try to support sleep. It sounds like sleep has been hard.
Yeah, sleep is definitely hard. They have tried to do, turning off electronics a certain, an hour before sleep. So that often leads to meltdowns. So that doesn't always work. And then they have also tried doing like baths and kind of a schedule at night. But that has also been inconsistently effective.
Thanks, Sabrina. Maria asked a really great question just in the chat about whether or not he likes or sees experiences in school. How does he feel about school?
According to his teachers, he loves school. And so when he is able to get there, he participates well and seems to be happy there. So it doesn't seem to be that that is the issue.
I think if grandma and mom need some support from the caseworker to help them with the strategies to how to motivate Muhammad in the morning to get ready for school. I think parent educating is something that I feel is missing here. Yeah. If you help the parents, they can help the child, right?
Yes, thank you on this. That's a very good point. Does anyone else have recommendations at this point? I know we've heard recommendations kind of through the questions as well. And just to answer your question, the child is 4.
So my son's preference is actually electronics too. And one of the things I found is kind of taking myself out of the equation helps, bringing in a third party, whether that's an actual third party or just the complete inability to access. So for him, in the mornings, the TV just completely doesn't work. There are locks set on the TV. It won't work until about 5 p.m., which is when he should be home from school, done homework, everything like that. And then as far as his iPhone and his tablet, those are all linked on parent apps. They're completely locked down in the morning, and I have the ability to add or subtract time from that. And they're locked down once it's bedtime. So as far as a positive reinforcement, if he does everything the first time, he can get added time on that. And he just knows, period, end of story, it's not going to work until, you know, he's done with school, he's gotten to school, he's done his homework, everything. So I definitely think that that would help a ton, because that was a huge issue for us.
That is a great suggestion, Marie. That is something that's really can be managed by a family. I think they can do that pretty easily, make that change. If Eric, I'm guessing, is thinking of our prevention strategies from last week. So would that kind of fall under setting events?
You know,
you're putting it right there.
yeah, no, this is what Marie just talked about is a really good example of avoiding situations for people. You know, certain people can ask him to do things other people maybe can't. She also talked a lot about controlling the environment. That lockdown she has of the app and what she does with the TV, brilliant, good control of the environment. What Summer is saying in here about sleep is important. That's really a setting event, something that sets you up to have a good day or a bad day. I had a horrible night of sleep last night. I got my booster shot and I was cold sweats all night. I've been grumpy all day. Sleep is important. Summer's right. And that would be a summer setting event. If a kid has a bad night of sleep, you got to lessen your demands on them that next day.
Oh goodness, what was this? Oh, Maria, are you on here? Maria Hearns? That is a great suggestion about the puzzle. Thank you.
Maria responded in the chat. She is here.
Oh, okay, thank you. Anything else? Any other recommendations before we move on to our discussion, our didactic?
I think, hello?
Yes, go ahead.
I think that they need some kind of help with him, because I remember at 4 years old, when my son was 4, I really didn't know what to do. And to me, he was very young. I didn't know. It was a new thing to me. I never heard of autism before. I never know how to manage something like that. And I had to have help. And I went to the doctor where they recommend walk around services. because with the specialists coming home, they were able to help me figure out how to help him, because he is a child with special needs, and with special needs you need that extra help, and I believe that they need to talk to the doctor or the psychologist, or that would request this kind of services for
I
them.
love that suggestion, Emanuela. You know, being a social worker, I'm always trying to help families get as much support as possible in their lives because it's so important. So thank you for that. And thank you all for all the great suggestions, questions, recommendations. Really appreciate you guys all taking the time to help.
You're welcome.
Amanda, do you want to introduce Eric for us?
Yes. Okay. So I am going to introduce Dr. Eric Butter as our presenter for today. Dr. Butter is Chief of Psychology at Nationwide Children's Hospital and Associate Professor of Pediatrics, Psychiatry, and Psychology at The Ohio State University. He is co-chair for the Autism Care Network, holds several executive positions with the American Psychological Association, including a seat on their board of directors. He's one of the developers of the RUBI Parent Training for Autism and remains involved in dozens of other autism research projects. He speaks widely on topics related to autism spectrum disorder, and today he's going to follow up on the discussion we had last week about RUBI. So Eric, take it away.
Hey, Eric, you're muted.
Sorry, I said move the slide and it looked like it moved on my command. So I thought I was talking to everybody. My apologies. Thank you, Amanda. I appreciate the introduction. But I'm really here for you, and I'm going to try to make sure that I spend these next 20 minutes talking through some little gems, as I call them, from our RUBI Parent Training Program. Remember, RUBI Parent Training is designed to be delivered by behaviorally oriented autism specialists who are therapists, counselors, social workers, psychologists. But what we've been trying to do in this Echo series is bring some of the ideas forward. What we've learned is so many of you are just good, natural behavioral teachers. In some ways, our kids with autism teach us to be better teachers. And so many of you have really good ideas already. You're answering the poll questions with a lot of ease in many cases. So some of this stuff, some of these gems, I think I'm just going to end up giving you vocabulary for what you know how to do already. But there's power in that too. If you're sitting there saying, "Oh, I know that," then that's really good, because now you know it even better now that you've thought about it and you've heard someone else talk about it. So I'm so glad you're here. The first part of this last week, we focused on how you reduce behavior problems. Today, we're going to talk about how you increase new patterns of behavior, how you increase new adaptive skills, how you develop behaviors to take the place of the disruptive behaviors that you've tried to reduce. It's very clear, given how we talked about this case today, so many of you appreciated the prevention strategies from last week, the idea of visual schedules, the ideas of scheduling. That warms my heart, because I think there is so much mileage we can get out of prevention. The other thing is, a lot of questions that came up in the case today really clearly highlights many of you are thinking about function. Why is he exhibiting these misbehaviors? And so you're putting a lot of thought into that, and that's good. Don't forget about behavior reduction strategies. Don't forget about understanding the function of a behavior. All those things are still important, but today we're going to talk about how do we increase new behaviors. These things all go hand in hand. Understanding function, why a kid behaves the way he does, understanding how to reduce disruptive behaviors, trying to help her not have those disruptive behaviors anymore. And now today we're going to talk about how do you increase new behaviors. Next slide. So we start with what we call compliance training. A lot of people don't like this term. It's a technical term that psychologists use to describe how do you help kids do what we need them to do, right? Every day is busy, as you heard in the case. Sometimes it's just a struggle to get through the morning routine. And it's much easier when kids are able to get through parts of their day with ease and with fluency, meaning they can do it fast and they can do it accurately. And if we can achieve that, then we're in a situation where our days are going to go more smoothly, and our kids are going to be moving through their days with a lot more ease. So we recommend a compliance training protocol that we think is pretty helpful. The idea here is that all compliance, getting kids to do what we want them to do, is a habit. And when kids don't do what we want them to do, when they're not listening to us, when they're defiant in some way, that's a habit too. And if you have one habit, you can replace it with a new habit. Remember what we said last week? All behavior is learned. And if you've learned one behavior, you can learn a new one. How do you learn a habit of compliance? Well, one way to do that is to make sure that a child never really gets to practice being non-compliant. We become what we do, we get better, we practice. If we let kids practice being non-compliant, we let them hear us, give them an instruction, and they get to not do it, then all we've done is reinforce the idea that when mom or dad or grandma or grandpa talks and gives you an instruction, you don't have to follow through. So what we want to do is we want to build a new pattern of compliance where every time they hear us give an instruction, they follow through and do what we actually ask them to do. So how do you make that happen? Well, you follow these basic steps. Step one, stand close to the child. Make sure you have their attention. They're looking at you. You know they're not focused on something else. You interrupt them if they are. You make sure they're not distracted. Step two, tell the child. Don't ask. Tell them what you want them to do. And give the command only one time. You're not repeating the instruction over and over again. It's not bam, 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 right? Come here, come here, come here, do this, stand up, sit down, right? We get in this habit of repeating our instructions over and over again, or sometimes saying them lots of different ways, thinking that if we said it a different way, a child will comply. If you have their attention, just tell them very clearly with as few words as you need to use to get them to do what you want them to do. Now, here's the really critical step. As you're giving that instruction, and you're close to them because you were close enough to give the instruction and get their attention, as you're giving the instruction at the exact same time, you are physically guiding the child to cooperate with you. If I ask a child to raise his hand, I'm going to be right close to them so that I can put my finger and my thumb around his wrist, and I'll say, raise your hand. At the same time, I'm pulling their hand up in the sky, right? So the idea here is that you are giving enough help to the child to cooperate with you the first time and immediately as you're asking them to do the thing you're asking them to do. If I want a child to come with me, I don't say, stand up and come with me. I say, making sure I have their attention, come with me as I'm putting my hand on their back and just gently guiding them up. This doesn't mean to say that you need to physically force kids to do anything, but it does mean to say if they're resisting you, you want to make sure that you don't force them to do it, but you also are using your other techniques like planned ignoring, prevention strategies to try to get through that resistance. And then as soon as they're calm again, you give the instruction and you physically guide them. As soon as they do what you've asked them to do, and even if you've helped them with some kind of physical prompt, some kind of help, then you just say, good job. Thank you for listening to mommy. Thank you for listening to daddy, right? So the idea is you are close to them, you give the instruction only once, you tell them very clearly what it is. As you do that, you help them do it with only as much help as you need to get them to do it and be successful. And then you praise them. Next slide.
Dr. Booter, Marcy is asking, it's like hand over hand, or is this like hand over hand?
Yeah, it can be like hand over hand, but remember, it's only as much help as you need to get them to do it. So sometimes if I asked you right now to give me a thumbs up, I might just do this, right? And all of you are very cooperative and you imitate very well and you know how to use Zoom and look at the screen. And if I say do this, that prompt is just a visual prompt, a gestural prompt. So I don't have to physically hand over hand through the screen, which I can't do, right? But the basic idea is that you only give as much help as you absolutely need. And hand over hand is a heavy help, right? But if that's what you need to do, that's what you should do. Because the idea is that we want to move away from the child ultimately. You want to be so far away that you can't do hand over hand. And so you want to fade hand over hand to a gestural prompt, to being further away as you get the gestural prompt, to eventually you don't get the gestural prompt. And when we talk about prompting here before we end today, you'll have some more ideas. Let's show what happens when a child struggles with compliance, even when you're trying to use our compliance training technique. Go ahead and show the video.
Boys, come on. Let's go. It's time for bed. Guys. Come on, it's getting late.
She's not close to them. She's far away.
Boys, come on, let's go. It's time for bed.
He's repeating this instruction 4 or 5 times already. You're really appreciating that this isn't working. And what are you got to ask yourself, what are those boys learning? They're learning how not to listen to mom, right? Let's take a look at the next one.
No, no throwing. Please pick the pepperoni up off the floor. Good. Good listening.
So you saw there, mom had his attention. She was close enough to give an instruction. She guided him to comply. And then even though she helped him, she immediately praised him, right? What's really neat about this is you can do this as much as you need to, over and over and over again. If you're going to repeat anything, repeat exactly what this mom did here, right? Rather than repeat the instructions over and over again with the kid not complying. Let's go on. So again, in terms of compliance training, what we're doing here is we are really thinking about ways we get kids to start doing new behaviors. A lot of times we are trying to tell kids to stop doing something. Stop that. Don't do that. Quit, right? We spend a lot of our time saying no, 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 no. What compliance training does, it flips that whole scenario. It completely flips the question. Instead of telling a child to stop, what we're doing is we're engaging them in what we want them to start doing. And that's really important because it's really hard to get kids to stop doing things. It's easier to get them to start doing new things with the kind of physical guidance, the kind of gestural guidance that we're suggesting. So give an instruction to the child, tell them what they should do, and be very explicit about what the child should do. Be very clear what you're asking them to do. Next slide. Sometimes we are also thinking about compliance training for problem solving. When a child is resistant to you, what do you do? And how do you get through that problem? And often what we recommend, if a child's getting aggressive when you're offering physical guidance, we would recommend that you work on commands that are very easily and quickly accomplished. Who wouldn't eat an M&M when you're holding it in your hand and you say, eat this M&M, right? I would. I love M&Ms. Of course, some kids may not like M&Ms, so you find a thing that they do like. Maybe they like to take Legos from you. Who knows what it is, but there are things that your child wants to do every day, likes to do every day, they'll do every single time you ask them to do it. And the key here is asking them to do those things that they will readily do and then praising them. So what's happening there? If you give a kid an instruction, hey, lick the ice cream cone. Strange, right? Who wouldn't lick an ice cream cone? Lick this ice cream cone. Child licks it and you say, good job. What's happened? They heard you give an instruction. They did it. You probably didn't have to help them to do it. And they got you praising them. So now they have learned, they're continuing to learn. They have lots of opportunities throughout the day to learn that you are going to give them instructions and then you're going to praise them. And, as you hear me saying this, we're even using tangible reinforcers or things that are immediately things that are going to feel good to them. But you always pair a tangible reinforcer with a good job, some kind of praise, some kind of social reinforcer that you're adding to it. Let's go on. The next new skill I'd like to talk about. First skill is compliance. Second skill is functional communication training. What is functional communication training? What this is it involves teaching a new communication behavior as a replacement for an old behavior. Last week, we talked about a very common way to talk about functions of behavior is that the child's trying to tell us something. They're telling us what they want. They're telling us what they want to stop doing. They're telling us they want our attention. So what we need to think about is if we're going to teach a functional communication strategy, what that really means is that we're giving the child some way to tell us what they want, what they don't want, that they want our attention. We're trying to give them a more appropriate way to do that rather than the negative behavior that they've been giving us. So go on next. So here's an example. A child is hitting to get out of sitting at the dinner table. He might hit his brother, he might hit his sister, he might hit his mom. And you have to think about, what is the child trying to communicate? Probably I want to get away from here. So the alternative is to teach the child to say, all done, I'm finished, right? Or maybe you teach them a sign, or maybe you give them a picture that says all done, and they have to give you the picture when they're ready for a break from the table. The key here is that we are trying to say, use your words, whether that's words as a picture, words as a sign, or words if you have them, and use those instead of hitting people. Next. The principles of functional communication really focus on two basic ideas. We're going to reinforce the child every single time they use the new communication skill, and we're going to do it as soon as they use it, and we're going to shape them to using that communication skill independently. Let's go on. The benefits of taking this approach is that it addresses behavior problems directly and proactively. Instead of engaging in a negative behavior to get what you want, we're going to teach you a positive behavior, a communication behavior to get what you want. It teaches what you want the child to do, not what they need to stop doing. And it promotes an independent skill. Sometimes when we teach functional communication skills, they naturally lead to other communication skills emerging, and kids become more independent with managing their behavior. We see these communication skills actually transfer from one setting to another relatively easily. Why? Because they work better for the child than the misbehavior, right? Hitting people gets me away from the dinner table. But gee, once I learn to say all done, and that gets me away faster, and it gets me away without hurting my hand because I'm hitting someone, or it gets me away every time when hitting someone doesn't always get me away, then the functional communication behavior is going to develop and be strong and be used in lots of different settings. Next slide. So here are some basic rules to walk away from when you're trying to teach a functional communication behavior. The basic idea is that we want you to recognize that the replacement behavior should work very quickly for the child. Again, it's gotta be something that is just easier to do than the negative behavior you're trying to replace. So it's got to work very quickly for the child. And the replacement behavior should work every time, right? So as much as you don't want to let the child get up and walk away from the dinner table, if you're really trying to teach all done and you want all done to be the thing the child uses to get away from the dinner table rather than hitting, then every time the child says, I'm all done, you have to let them go, right? So you have to be prepared to follow through on the communication behavior in a positive way. Later, we can teach, well, not now, why don't you have 2 more bites? But you won't do that the first time the child uses all done, right? You want it to work for them the first time they use it, and you want it to work for them every time they use it. But you can later negotiate and shape it to be a more durable pattern of behavior over time. The other thing is to keep in mind, I've said this a couple different ways, but I'm going to say it very clearly here. The replacement behavior should be less effortful. It should require less work than the challenging behavior would, right? So you don't want to ask a child to use a full sentence if they usually don't speak in full sentences. Even if the speech therapist is trying to work on getting a child to use full sentences or trying to get a child to use pronouns, that's good for speech therapy. And that's good for other times where you're trying to teach language. But when you're trying to teach functional communication and you're trying to reduce disruptive behaviors, that's not a time to be teaching a new skill. That's a time where you're trying to use the most efficient way that the child already has to communicate, whatever that may be. If it's one word, if it's pictures, if it's signs, whatever the strategy is, you want to make sure you're using the easiest way that they already know how to communicate. Next slide. So here is a brief example. Imagine we have a 5-year-old named Tommy. He has about 10 words. So he has some words, but not many. And he hits his sister when she takes his toy, right? So you can imagine what the issue is here. I don't want my sister stealing my toy. I want to get my toy back, right? So this is kind of a tangible function. Give me my toy back. He wants to gain access to the thing he lost. He wants to gain access to this tangible thing that he likes in his life. And so what does the mom do? She's using a functional communication strategy. Well, his parents could teach Tommy to point to a picture of mine. It's mine when he wants his toy back by practicing repeatedly, taking a toy of Tommy's and prompting him to get it back by pointing to the sign of the picture. So think about what I'm saying there. You have to teach this, right? You just can't wait for that moment in life where it happens, because he's going to be hot. He's going to be angry. When his sister takes his toy, he's going to want to just slug her, right? So you want to create other opportunities, lots of discrete moments where you are taking something away from him, and then you immediately have a picture that says mine, and he points to it, and then you give him back what he wants, right? So it is easier to teach this if you're creating lots of opportunities for him to learn how to do it. And so we often will recommend that you do this 10, 15, 20 times a day in planned ways. And then it'll be easier when you catch the moment with his sister to get him to use the pointing to the picture of mine. Next. So keep in mind that behavior is a form of communication. When children do not have verbal language, they don't have a lot of words, functional communication is extremely important. I would argue that functional communication is important for all of us. Right now, I spend a lot of time teaching the people who work with me to use what I call intentional communication. You know, because workplaces are complex. We can make each other mad pretty quickly. A lot of times our intention isn't to make each other mad. And so I often tell the people I work with, always start your sentences with, I intend to, and then say what you're planning to do, right? This way people know what your motive is. I do that with adults who are working at a hospital, right? We all can benefit from functional communication training, but clearly when a child has few words or no words, functional communication training is even more important. This is less obvious for children who have verbal language, so to be a little bit more thoughtful about how you use functional communication training, but I would contend that functional communication training should be a part of every child's behavior support plan. Next slide. When you think about the immediate benefits of using functional communication training, clearly you're replacing a negative behavior that's causing problems with a functional behavior, with a communication strategy that is going to get a child what they want. And you should think about what's challenging about this. Once you actually try to do it in real time, real significantly, maybe hot situations where a child is just angry, you got to get in there right away, right? So it can be hard to use at the point of performance where you really want to see this new behavior be developed. So it's not easy, but it's worth the effort. Next slide. We're going to talk just a little bit about how to teach, and we'll talk about chaining and prompting for a couple minutes. As we pivot to teaching skills, I want to recognize that it's really important to teach adaptive skills quite explicitly. If you want to teach a child how to wipe their mouth with a napkin, we need to teach that. We need to spend time teaching a child to do that. If you want to teach a child how to put on their shoes or hang up their book bag every day when they come home from school, it's important to teach that. We should develop very specific strategies to teach everything we want to teach. It's ultimately critical to teach a child what to do, and again, not what they should just stop doing. And so whenever you think about a behavior problem that you're trying to reduce, you should also be thinking about what new skill do you want to teach them that might be related to that. Next slide. So some things to teach. You might teach play skills. You might teach leisure skills, how to relax, you know, like sit and watch a television show. Teach social skills, teach self-help skills, teach organizational skills, teach academic skills for kids that are in school. Teach coping skills. How do you manage your emotions when you're upset? Next slide. The first question you have to ask yourself is, what skills will help reduce my child's problem behavior? Another question you can ask yourself is, what skills will make my child more independent and less reliant on me? What's going to make your life easier? Another question to ask is, what skills does the child seem to have most of the steps for, but refuses to do or finds frustrating? Maybe a child can brush their teeth, but they can't take the lid off the toothpaste, so they're not completely independent. You still have to go in there and get them started. Oh, well, maybe let's teach them how to get the lid off the toothpaste. What would a child be most motivated to learn, right? What would, if this was an independent skill in their life, what would they really be motivated to learn? You can focus on a skill you want to teach by answering these questions. So I hope you bookmark this slide when you get access to it, and you come back to this and you are always thinking about, what's the next thing I want to teach? You take a week or 2 or 3 to teach one little skill, come back to this slide and help you think about what the next skill is to teach. Next slide. Chaining is one of the most important teaching techniques that we use. Chaining is a technique that we use where we develop a sequence of responses. Think of the steps it takes to make a peanut butter and jelly sandwich, right? You got to get the jelly, got to get peanut butter, you got the bread, you got a knife, you got to open the jars up, you got to put peanut butter on the bread, you got to put jelly on the other bread, you got to put the two together, you got to cut it in half, right? A lot of steps. And chances are, if I asked you to come up with the steps to make a peanut butter and jelly sandwich, you could probably make twice as many steps than I just listed. That idea of writing out the steps of a particular task is called a task analysis. Think about what the tasks are in brushing your teeth, or in tying your shoes, or putting on your socks, or in making your bed, right? Anything you do every day can be broken down into a step-by-step sequence of all the steps you need to build that task toward a finished outcome. Next slide. So here are some things to consider. As you build the task analysis, you're going to end up working to chain those steps together. And you're going to teach only one step at a time. But once you teach one step, you're ready to teach the next step, and then the next step, and then the next step. And the child just continues to learn one step at a time, and they've learned all the steps in front of that. The other way you could do it is you could teach all the steps in a backward sequence, where you ask the child to do the last step first. And then you do that because you've done all the steps before that. Imagine if I told you to run a race, and you could run the race any way you want. As long as you win, that's the only important thing. Well, if you're smart, you'll say, I'm going to start 2 inches away from the finish line, right? And that's what we do sometimes with kids, is we do all the steps of a task analysis, and then we ask them to do the last step. And then after they've mastered that, we do all the steps but the last 2 steps, and we teach the second to last step. They already know how to do the last step, and then they're done, right? The reward of teaching the last step first really helps us focus and emphasize this idea that when you do this, you are finished, whatever it is that you're working on. Sometimes, though, it's important to think about when you're trying to teach a step, is you want to teach the easiest step first. So sometimes you might even start in the middle. And regardless of what step you're teaching, it's very important to focus on reinforcing each step as it comes. Now, I really just have 2 more concepts to talk about. Let's go on to the next slide. Here's the slide that talks about forward chaining and backward chaining. So forward chaining is the idea that you teach the first step of the chain, and then you teach all the subsequent steps after that. Backward chaining is that idea of you run the race by starting at the finish line, where you teach the last step in the process, and you start teaching the steps in a backward manner to the beginning. But let's go to the next slide. Because here I want to talk about prompts. And the idea is that you are using prompts to help the child do what you're asking them to do. You want to guide them in some way. Sometimes it's hand over hand and it's physical prompting, like guiding the child by the arm to pick up a block. Other times it might just be giving them a verbal hint, like pick up the big block, right? In this case, you're using the word big to indicate which one they should pick up. Next slide. We have lots of different kinds of prompts. I've talked a lot about physical prompting today, hand over hand prompts, physically guiding a child. But you can also use just verbal prompts. Like right now, Amy's probably thinking, I need to tell Eric to hurry up, right? Because I'm a little over time again. So she's probably saying, Eric, hurry up. Other times we might use modeling, where I just do something and I expect you to model after me. Watch this, and I drink from my cup, right? And I want you to also drink from your cup. A lot of times we'll use visual prompts. We'll like visual stimuli, like you were talking about visual schedules in the earlier case. Next slide. There are some ways to think about using prompts. And the first thing is to really recognize that you should only use prompts that are needed. And you should use several different prompts to teach a skill. Don't limit yourself to just one kind of prompt, right? Use as many prompts as you need to teach a skill. And add prompts when you need to, but then take them away when you think a child could do them with less help. So this is very simple. Use only the prompts you need. Use all the different kinds of prompts that you can possibly use. Add prompts when you need more help for the child, but be sure you try to take them away just as fast as you've added them. Next slide. Actually, Amy, I'm going to skip this here. So let's skip the idea of stimulus prompting and delay prompting. And we can always come back to that at a different time. So let's go through this slide. We'll skip the time delay. And I want to end on this because this is really important to think about in the context of teaching. And I really liked, it was mentioned a lot in the case study earlier. Someone said, I forget which participant talked about this, but someone mentioned, how are transitions going at school for that child? That was really a fantastic question, because what you're searching for there is, do we have this behavior problem in both settings? Or is he better at transitions in school? If he's better at transitions in school, why? What's the structure of school? What's the teacher like? Why do we think he's better at transitions in school? Does he get through a routine at school more easily than he does at home? And if you can start to think about and analyze that, it might give you ideas for how you want to change things at home. Most of the time, though, we're thinking about generalization from the perspective of, you did this. You've created a behavior change in a child. You've either reduced a negative behavior or you've increased a new behavior. You did this, you made it happen. So how do you get it to work with other people? And then the other thing is you did this, right? You made this behavior change occur. How do you get other behavior changes to occur as well? And how do you get it to keep happening? How do you sustain it over time? That's maintenance. Next slide. So one way that you build maintenance, how you keep something happening, is that you continue to reinforce it. But you also have to think about fading reinforcement, so that you end up delaying that reinforcement or you providing it intermittently. So at first I told you when you're doing functional communication training, you're going to reinforce every single time the child uses it. All done. Yes, you can leave the table. All done. Yes, you can leave the table. But you've done that for a week and now he gets it, right? Maybe at week 2, you start to say, you know what? Why don't you just spend 5 more minutes here and eat? And I'm going to set a clock. And when that clock goes off, if you still want to leave, you can ask to be all done again, right? So you can try to delay the reinforcement for 5 minutes or 1 more bite or 3 more bites. Next slide. When we talk about maintenance and generalization, we're usually asking people to think about teaching a skill or trying to reduce a behavior in different settings with different people. You should do this gradually. It's also very helpful to use naturally occurring reinforcers that we know are going to be in the environment. And it's also really important to make sure that you have consistency across settings, that everyone who works with this child knows the plan. This is why last week when I told you about using a behavior support plan, that you were going to be writing it down, and that was going to help you share it more easily with other people. Next slide. So remember, RUBI is a psychotherapeutic intervention. You probably won't get much out of buying these books. You can buy them at Amazon if you want, but you probably won't get much out of them because unless you're a psychologist or a therapist, it'll probably not really resonate with you. But finding a RUBI therapist or finding a good behavioral therapist who knows autism and asking them to do RUBI with you, because they can buy the book. And if they're trained and licensed, they could easily probably do RUBI, or they could join us for some of our Echo RUBI sessions where we train clinicians how to do RUBI. You can get more of this tailored to your child and your family. Our goal here was just to give you some gems to help you get started. I think I'm done here, Amy, finally.
Awesome, Eric. Thanks for doing that. We're going to go ahead and launch our poll while we tackle some questions right away because we are running over on time. Eric, you shared so much great information with us today. As folks are thinking about questions, please take a look at these 5 poll questions again and give it your best answer. You got some hints in the chat today that we were going to ask you again about things like prompting and chaining and questions 4 and 5. And Eric, as folks are walking through that, I wonder if you might tackle a question that we had in the chat from Deborah that I think is helpful to think about. When would you describe that backward chaining might be helpful?
You know, it's really a good question. A lot of people prefer backward chaining because it really builds compliance and it brings naturally occurring reinforcement right to the forefront of your teaching strategy. You know, when you're asking someone to do the last thing first, they get the outcome, right? So imagine unwrapping a piece of bubble gum. So I take it out of the package, I begin to unwrap it, and all the child has to do is pick the gum off the wrapper, right? And put it in his mouth. Wow, that was easy. I just grabbed it and I put it in my mouth. I instantly have bubble gum in my mouth, right? And then the next step is it's wrapped on loose, but the paper's a little bit on top. You open it up and you put the gum in your mouth. That is going to be far more reinforcing than asking the child to open a pack of gum that hasn't even been opened at all.
Yeah.
And anything you want to teach, that's going to be the same scenario. You get to the outcome faster. And so
with less frustration, right? I would say, right, less frustration. And some parents, I imagine, have talked with providers and teachers about the concept of errorless learning too, right? Which is different, but related to this idea that some kids may do better with more support up front or starting with that sort of backward chaining model. I know we're short on time, but we have one other good question that I think was related to some of the other questions that came earlier about how this can be used for teens. So how do we think about some of these concepts differently for older individuals, and how effective can these strategies be for teenagers as well?
Yeah, I think any of these strategies could be really effective for teenagers. You might want to be a little more careful with you going right to physical prompting with an older and bigger kid, you know, especially if you have a pattern of of frustration or aggression in children with physical prompting. So you have to be thoughtful about using physical prompting. That would be one of my cautions. One of the strategies I chose not to talk about here was the time delay cue, but I can explain that very quickly because it's often very helpful with older kids. And the idea is that if I asked you to do shuttle nut right now, Lisa, could you do shuttle nut? You have no idea, right? You don't know what I'm asking you to do. It means nothing to you. But if I said, Lisa, shuttle nut, right? And then I say, Lisa, shuttle nut, right? So she does that easily and fast. But let's say she didn't do it really fast the second time. And if I said shuttle nut, I count 1, 2, 3. She beat me, right? But if I got the 3, I would have used my gestural prompt and would have showed her what to do. So that's how you can use a delay cue prompt or a time delay prompt, by counting between the time you deliver the command, shuttle nut, whatever that is, and the prompt, or in this case, physical model for what she's supposed to do. That can be really helpful with older kids.
That's great, Eric. Thank you so much. If anybody hasn't answered the questions, please go ahead and answer those poll questions. I think we're just about ready to move on to our next section. And we'll try to tackle some of your remaining questions in the chat as well.
Okay.
I think I'm passing it off to Amanda next.
Yep. So, so now we're going to have a couple of our hub team members share their perspectives, and we're going to start with Ellen sharing the perspective from a sibling.
Thanks, Amanda. You can go to the next slide. So a few different comments. Just first and foremost, I think teaching opportunities end up being a part of everyday life for families, and that's really important. As a sibling, though, growing up, sometimes it felt like we were all on a behavior plan. And I remember friends coming home and seeing the visual schedules or the visual cards around our house, like, oh, do I need to follow this when I go to the bathroom, or do I need to ask before I go outside? And it was something that maybe I shared with them, but it's something that was a part of our life. And I did like being incorporated into some of those teaching routines. I also think parents need to keep in mind that maybe a sibling might not want to be a part of that teaching opportunity at that moment and may have different feedback too. Now the laundry, I wanted to share about laundry because we use backwards chaining to support my brother to learn how to do the laundry. My brother still lives at home and he does all the laundry at my parents' house. We started small. We started with backwards chaining, which for our house, that would be unpinning the socks and then matching them and putting them together. And then backwards from that, what would it look like to fold clothes beyond the socks? So socks and shirts and pants. Then the next step backwards would be changing out the laundry to the dryer and then starting with the washing machine. Now today, if anyone adds an item or puts laundry near our laundry room, my brother is ready immediately to do laundry at any moment of the day. There's rarely a time we have any dirty laundry, and our house is very clean, I guess. I've learned, though, coming back home for visits, not to interrupt that routine, or if I don't want my laundry done in a certain way, I need to just do it myself or to tell him. I have very complicated laundry sometimes, and so sometimes I just don't do my laundry when I go home to interrupt the routine. At the same time, laundry's all done, and it's a skill that my brother now has as an adult. I'm going to pass it along to our next team. Yes, Amy.
Thank you, Ellen. That was great. It reminds me, like, when I use backward chaining to teach Henry how to make meatballs because he loves spaghetti and meatballs. So the end product, right, is the meatball he gets to eat. And now we do it from beginning to end, and he gets raw meat all over the place. But other than that, we're doing really good with it. All right, everybody. So I wanted to just give you a parent sort of perspective on the content that Eric shared today. And raising a kid with autism is had moments where it's been, we've had really easy moments and we've had more difficult moments with behavior. And I think it's just always important to kind of look at, how we are, sort of expanding our knowledge. And, I think the one thing that I've learned as a parent is just to really learn, and as the parent of Henry, who has on occasion had some challenging behaviors, I really knew that I needed to learn some techniques and skills that would assist me in understanding and managing his behavior. And for me, I'll be really honest, learning behavior management techniques was a different way for me to think, and it did not come naturally. So I was really, looking for some people that could help me with that. And I worked with our team, I found professionals who could help me in that. And it was really helpful. So I think the first thing I would say as a parent is really to expand your knowledge, even when it doesn't feel comfortable. But then I think also the other thing I learned is really to ensure your understanding, right? So I think if you take the time to learn from professionals on your child's, behavior teams, really ask a lot of questions. And I think one of the aspects of RUBI that I really liked most is that, I've been able to work directly with a professional who has a really solid foundation in behavioral strategies and, understanding behavior. And I've been I'm really fortunate to work with this team who's really RUBI trained, and I've been able to learn a lot of behavioral strategies, and I've been able to participate with them to ensure that I feel really comfortable and confident in using techniques like, the backward chaining and prompts and things that Eric talked about today. But I think, the thing that I found is that I became more confident with the strategies when I started to apply it. And I was allowed to practice with them before I actually started to apply it. And now it's something I do really naturally. It's just a part of my life. And, because I've done it for so many years. And to be honest, I practice plant ignoring with my husband on a regular basis. And he doesn't know it, which is fantastic. So some of these skills you can stretch into other aspects of your life. But I think also it's really important to share what you learn, and with RUBI, I think one of the things that I realized is that, I have to share what I've learned back with my family, but also to the other people who have been a part of Henry's team and are a part of Henry's team, whether it's at school or whether it's in his art community, so that he gets consistency across all of us. So, I think I've learned that as a team, we really need to work together collectively to apply what we know to ensure that he has the most successful days, the most successful moments. And, we just continue to build as much opportunity as possible for him by just really being consistent in the strategies that we use with him, so that he can continue to be successful. So thank you for listening to the perspectives today. Thank you to Eric for the presentation and everything. I think we're going to move on to resources now. So Laura, if you want to move to, you've already moved to that side. And I'm going to turn it over to Andrew to talk about resources and supports and even some of the things that may have come out of today's session. Andrew?
Yes, thanks so much. So in between these sessions, if you're in your local, region, community, and you're thinking, boy, I really need to find a resource about this topic. Like some people were asking about, grant support for their classroom, or maybe where to find a RUBI therapist. I encourage you to reach out to us. And on the next slide, you'll see contact information for the ART. And that is the Autism Response Team at Autism Speaks. We're a group across the nation, available 9 to 5 by chat and call. At these numbers, we have a Spanish line as well, right here, the 1-888-772-9050. But you can also send us an email at help@autismspeaks.org. And we're ready to try to help you with just about any question you have about information, local resources, local services in your area. And our team of folks are ready to get you connected to the information you need. So just want to encourage you between these sessions, if you're stuck, to reach out to us and we'll do our best to help.
Hi, everyone. This is Melissa. I just popped a link in the chat. Please give us your feedback. We want to know how you like today's session. Send us any ideas that you have. And go ahead to the next slide, Laura. And just so everybody knows, all participants attending the October RUBI sessions will receive a certificate of participation. You'll get an email with that in a few days. Next slide. And for all other session materials, session recording, slides, resources, that will all be emailed to you within a few days. And you'll have access to everything that we've talked about today. Next slide. And I think Amy's taking over.
Yeah. So again, the Autism Care Network really helps to sponsor this series. So I just wanted to give you more information about them. You can find them at either one of these links and see a little more information. And I think last week, Angie referenced a video that's on there. It's great to kind of see the work that they're doing. So check that out. And then next slide. So this is the ending of our October series. In November, we're going to have 2 sessions. The first one's going to be on November the 10th with Lisa Nowinski and Amanda Bennett, who are part of our hub team here. They're going to talk about ADHD and when is it more than just selective hearing or being a kid. So that session is on a Wednesday from 4 to 5. And then on the note, November 18th, we're going to do anxiety and understanding and managing it in autism. And again, Lisa and Amanda are going to present that one. Now, these both have different registrations because they're very different. So you're going to see 2 registration links that will be sent out at marketing materials, and we'll drop the link in here too for you to see it. So if you want to register for those, please do so. And again, we have a satisfaction survey. Please fill that out so we can get more information from you. And I think we have a few minutes. We can take a couple of questions if there's anything lingering. And Laura, you can stop sharing if you'd like to.